Out of her brothers and sisters, the 8 that lived to be adults, she said there's just one that didn't get diabetes. And she already seen out of her 5 children, her oldest daughter had diabetes. And she said she couldn't live. She couldn't live with herself if she were to take one of her kidneys, and one of us would eventually need it.
My mother, she died of diabetes. So she had double pneumonia. She had cardiac arrest. My dad died of a heart attack when I got back from Vietnam, and I tested positive for Agent Orange. And the VA said it was, they wouldn't help me. They stated something would give me $1,500, and that's all they done for me. And then, and now, years later, they're telling me that Agent Orange caused type 2 diabetes.
What do you think is one of the most important things when you go get your health care or treatment?
The most important thing, I think, is to see a physician and not a nurse practitioner. They don't talk to you about seeing a dietitian. I think you should ask, to make sure that you're eating the right kinds of food. Keep up on, when you go on, ask a lot of questions. That's one of my downfalls. I don't.
So like when you go for your foot care and your eye care, who refers you for that? Does your...
I just keep track of it myself. They never ask me, have you had your eyes checked?
So in other words, you're responsible for yourself then? That's
Yeah.
good.
When I first was told I had to take insulin, I was scared because every person that I've known starts taking insulin, and then they end up going on dialysis, and then next thing you know, they're not around anymore.
They thought it was easy for my mom to get from Wombly to Pine Ridge. It's an 85-mile trip. And the cars we were driving, they were right smack in poverty. There's 88 unemployment rate here, 88% unemployment rate here where we live. And the cars that we were driving back and forth, we ran down 5 cars the whole time she was going back and forth to treatment. We'd leave here at 4:30 in the morning to make it there, at least in a half an hour before, so mom wouldn't miss out on any treatment. The thing that makes me feel bad is some nights she never slept. She just wanted to live so bad that she didn't want to miss that treatment. So we'd get up that early, or she'd stay up that to wake us up. She went by with the bare necessities, and she made it to every appointment, to every dialysis treatment. At the time, I was giving my mom 31 pills a day that was prescribed to her by her nephrologist, and plus by her heart doctor, and plus by her general physician. And he took a look at that, and then that's when I think he took it, because even mom at that time couldn't eat, and she was very, how would you say it? She could barely walk by herself, and she was real sleepy, like in a sleepy state. And whenever Dr. Raymond made the comment to me that she needed to start eating, then I made sure that he knew. I said, how could I get her to eat when I'm feeding her 31 pills a day that are making her stomach upset? And then he checked it out. He looked like he did a thorough drug interaction background on it, and he ended up taking her off of 19 pills. And after that, like within 2 weeks, my mom was back to normal. If it was me or someone she loved, she'd be after them to take care of themselves. Mm-hmm. I think it'd break her heart to know that Becky's got diabetes now, and that's her baby.
How old is Becky?
Becky's 8. She was 18 when she was diagnosed, but she's 19 now. And one of the things I think mom would be telling her that she never did was to take care of herself.